Hello, I'm Dr. Botros Rizk, reproductive endocrinologist. I am a professor of obstetrics and gynecologist at University of Southern California School of Medicine and division chief of reproductive endocrinology. I practice infertility and reproductive endocrinology at HRC Pasadena office. I had my OBGYN training in London, England, and then my fellowship also there, and then joined Cambridge University in Cambridge, UK, following that. I was very fortunate that at the time I did my residency in OBGYN, IVF was just developed by Professor Robert Edwards, Professor of Physiology at Cambridge University, and Dr. Patrick Steptoe. I was very, very excited about it, despite my lack of even imagination of what does the field involve. I was honored, and it has been really my life honor to be one of the first group of fellows that were mentored by Professor Robert Edwards. At the same time, there was what I call the legendary trio. We had Professor Stuart Campbell, who was the pioneer of ultrasound in the world. So he really stimulated our dual approach to ovarian stimulation and IVF with ultrasound, as well as Professor Howard Jacobs, one of the world pioneers in reproductive medicine. Truly, I grew up in a family of physicians. My mother was an OBGYN for several decades. My aunt was also an OBGYN, and my uncle was a general surgeon, and literally everybody in the family was a physician and also married to a physician. So I grew up in that environment, but the impact of my mother subconsciously affected me so much. She's never intervened or interfered in what studies I do or what universities I attend, but her success and her dedication was beyond belief, and really it affected me for the rest of my life. So the career has been delightful and long, with lots of hard work. One of the most exciting moments in terms of clinical practice has been the development of transvaginal ultrasound. So I was mentored by Dr. Robert Edwards and Patrick Steptoe, who really pioneered laparoscopy in the UK, and before him there was no really laparoscopy. So all the egg retrievals for the first few years were done by him by using laparoscopy. Then the fellowship program joined hands with Professor Stuart Campbell, a world pioneer in ultrasound, as very well known. So we started using transabdominal ultrasound for egg retrieval. And these were technically demanding and very, shall I say, very uncomfortable to many of the patients that we go through the abdominal wall and bladder. So when the transvaginal ultrasound was developed by the group in Vienna, as well as the Denmark group, it was to us like a dream come true. Now we can do an egg retrieval in 10-15 minutes. Now everybody is very comfortable. So this has been a very exciting moment. Another great moment in the career is that we worked very hard to achieve pregnancies in the 80s, and when we completed 1,000th live birth by the group, which actually were the first 1,000th live birth by any group in the world, it was a moment of tremendous excitement. It led me to look at the congenital anomalies as well as obstetric outcomes, because these in particular were considered like areas of question mark in terms of IVF. So many people in Australia suggested that there are some anomalies, whether they do with the spina bifida or transposition of the great vessels. So when we reported the first 1,000 babies and showed that they were very comparable to a naturally conceived group of babies in the UK, that was a major relief to all of us. At the beginning of the fertility journey, we have to explain to all our couples that this is a process that goes stepwise. Like first, we try to achieve complete evaluation within the first month, then plan a treatment together. I give them the best advice, but they make the decision for themselves into what they choose. And the range is unbelievable, from people who don't want to do anything to people who want to do everything. And you have to really guide them well so they make the best, not just informed, but the best meaningful decisions for themselves. And you have to be honest and transparent enough, but at the same time let them take the lead in terms of their final conclusion. The road could have ups and downs like everything else in life, and many of them really suffer through that, and I tell them that we will be there for them throughout everything they go through. Truly, I believe that HRC is one of the leading IVF centers in the world today in three respects: the top science that is available, the latest technology, and the highest level of precision. This is a given that if you want to have a successful and top quality IVF center, you have to have that built in your program. And HRC excels above and beyond in all these issues. Second, we do everything that is possible to provide the best advice and the greatest answers for any patient questions or concerns, whether this being an egg freezing, whether this being an embryo transfer, whether this being embryo storage, or even genetic disease. I'm Dr. Botros Rizk, a reproductive endocrinologist and infertility specialist in Pasadena, California. I work as professor of OBGYN at the University of Southern California and division chief of reproductive endocrinology and infertility. I do all my IVF cases and all the fertility practice at HRC Pasadena, and it has been my delight and honor to be part of this great team.